Hello everyone, welcome back to the channel. Next Ben here, and I'm happy to see you again. We've got a video today, and in today's video, we will be talking about diuretics. Now, in the last video we did, where we treated hypertension and all we need to know, one of the medication groups we said was used in the management of hypertension was diuretics. Welcome back to all my returning subscribers. Thank you for coming back onto the channel. To my new subscribers and new listeners, we are glad to have you on the channel. We hope this video will bring value to your time, even as you watch through. If you haven't done so yet, kindly hit the subscribe button and then the bell button so when we release a video, you'll be one of the first people to see it. Now let us move right into the video. So today we'll be talking about diuretics. Now, what do we need to know about diuretics? So diuretics basically are a group of medications that we use to help remove excess water from the body. What it does is that it helps to prevent fluid buildup, so excess fluid buildup, and then it works mainly on the kidneys, and it may sometimes be referred to as the water pill. So there are about 4 different types of diuretics that are used in the treatment of hypertension and other fluid overload situations and conditions. And we've got the loop diuretics, we've got thiazide diuretics, we've got potassium sparring diuretics, and then we've got osmotic diuretics. Now, before we move into the video and talk about the individual types of diuretics, we want to just briefly go over the kidney and look at the parts of the kidney when we take a nephron, the parts of a kidney. And then this will help us to appreciate where these medications work on the kidneys and how they help to excrete excess water from the body. So before we dive deep into these medications and which part of the kidneys they work on, we want to just briefly go over the anatomy of a nephron. So on the picture on your screen, you realize that we've got our afferent and efferent arterioles forming the glomerulus, and the glomerulus sits in your Bowman's capsules. Now, coming down from the Bowman capsules, you've got your loop of Henle, then you've got your distal tubules, and you've got your collecting ducts, and then where urine then is drained into the ureters and then down out into the bladder. So you realize that in the loop of Henle, the distal tubules and the collecting ducts, sodium and water reabsorption takes place in this bit of the nephron. So you realize that in the medications we'll be looking at, these medications works on different parts of this nephron in order to be able to get rid of water and sodium appropriately. Now let's look at the first type of diuretics, which we call the loop diuretics. Now with loop diuretics, what we know is that they've got a suffix ending in either MID or NID, so MID or NID. So you've got medications like furosemide, you've got medications like bumetanide. This group of medications are what we refer to as loop diuretics. Now let's look at how loop diuretics work. So what loop diuretics does is that it inhibits the reabsorption of sodium and chloride in the loop of Henle and in the distal tubules. Now, by so doing, it causes depletion of water and electrolytes. So literally, you are getting rid of water and electrolytes as a result of you taking a loop diuretic. What it also does is that because it gets rid of water and some electrolytes, it increases your uric acid and also causes the excretion of calcium. Now, if you want to diurese a patient quickly, then your go-to diuretic will be loop diuretic. So your furosemides, your bumetanides, and then your tosimides. This ones helps you to quickly diurese a patient. So it does this by decreasing your intravascular volume, decreasing your cardiac output, and reducing your blood pressure. Loop diuretics are mainly used in patients who have hypertension, pulmonary edema, heart failure, hyperkalemia, and renal disease. Now, it is used in patients who have hyperkalemia because we said that it increases your secretion of calcium. So it helps the body to get rid of calcium more. And so if someone is having hypercalcemia, it is a good drug to use to help reduce the level of calcium in the blood. Now, with every medication, once you begin to use it, you need to use it carefully in a certain group of patients. So we want to look at some group of patients where we need to cautiously use loop diuretics in. And the first group are clients who are receiving digoxin and or lithium. What this does is that it increases your risk of lithium and digoxin toxicity. Now, we know that hypocalcemia is one of the leading causes of digoxin and lithium toxicity. So if loop diuretics helps you excrete calcium, it means that it gets you to be hypocalcemic quickly. And if you're on these medications, you are likely going to go into toxicity very quickly because they've got a narrow therapeutic range. Also, clients who are taking amino glycosides like gentamicin and neomycin, what loop diuretics does to the concentration of this in the blood is that it usually increases the concentration of these medications in your blood. Also, clients on anticoagulants are a group of patients where we cautiously use diuretics in. Moving on, the next group of diuretics we want to look at are your thiazide diuretics. These ones have got a suffix that ends in thiazide. Obviously, they are thiazide diuretics and they've got a suffix that ends in thiazide. So it's a bit easier to identify this type of diuretics when you see them. Now, the way thiazide diuretics works is that they inhibit sodium reabsorption and water in the distal tubules. So this was the reason why we looked at the structure of the nephron earlier. So we see that these medications work on different parts of the nephron. It also increases the excretion of sodium and water, thereby helping you reduce fluid excess in the body. Now, in what patient group do we usually use thiazide diuretics? Now, we are looking at patients who have got hypertension, those with peripheral edema. We also used in clients with normal renal function. Now, some medications, because they are secreted or they work on the kidneys, when the kidneys are not functioning well or they're not in good condition, then you want to use them with caution. So once a patient has good renal function, then thiazide diuretics are one you can use in them. The other thing I need to mention is the fact that it is not very effective in immediate diuresis. So if you are looking to get a patient offloaded quickly, then thiazide diuretics are not your go-to diuretics. You want to go for loop diuretics, which are active relatively quicker to help solve your problem. So we mentioned that with every class of medications, it needed to be used cautiously in a certain group of people. With thiazide diuretics, we have some group of patients where we need to use them cautiously in. And the first group are the patients who are on digoxin and or lithium. Also, patients who are on corticosteroids and are on hypoglycemic medications, you want to cautiously use these in this group of patients. Patients who have got gout or sulfur allergy are also ones that you want to use thiazide diuretics in cautiously. The next group of diuretics we'll be looking at are your potassium sparring diuretics. Now, potassium sparring seeks to tell us that these type of diuretics do not encourage the excretion of potassium. Rather, it helps in the retention of potassium. And so a typical example is spironolactone, one of the commonly used diuretics. And so how it works is that it works on the distal tubules and it promotes sodium and water excretion. But in this circumstance, instead of wasting potassium, your potassium sparing diuretics will rather help you retain potassium. Now, in what circumstances do we use potassium sparing diuretics? So we've got patients who are edematous, patients who are hypertensive. We also use potassium sparing diuretics to increase your urine output and to treat fluid retention and overload. Now, potassium sparing diuretics are used to treat diuretic induced hypokalemia. Now, we know that with other diuretics like the loop and then the thiazide diuretics, they excrete more potassium. But when you have potassium induced hypokalemia, then a good treatment will be a potassium sparing diuretic. What it does is that it helps you to retain sodium, and then it now bring your potassium levels to the normal. And then we know that our normal potassium is usually 3.5 to 5 milliequivalents per liter. Now, like every other medication, it needs to be used cautiously in patients with severe kidney and hepatic disease. Moving on to our final type of diuretic that will be discussed in today's video, we've got osmotic diuretics. Now, a typical example of this is mannitol. So what mannitol does is that it increases the osmotic pressure of the glomerular filtrate, inhibiting the reabsorption of water and electrolytes. So unlike the other three we talked about that works on the loop of Henle, the distal tubules, and you're collecting that, your osmotic diuretics tend to work on the glomerulus itself. Moving on to the uses or the patient group where we can use osmotic diuretics. The first group are patients who are oliguric, and then we want to use osmotic diuretics in patients who have kidney failure, and so you want to prevent worsening kidney failure. Now, osmotic diuretics like mannitol are very much important in the treatment of increased intracranial pressure. So you realize that in your acute ICP elevations, you give some mannitol, and what it does is that it helps offload the fluid that is on the brain. So you found out that in acute situations where patients have blown a pupil or have fixed their pupils, mannitol is one of the quick temporary fixes you can get before you get expert treatment. Also, mannitol helps in reducing intraocular pressure. And I want us to note that mannitol sometimes is used in chemotherapy to induce diuresis when there is fluid overload or fluid retention. Now, one of the main considerations we want to look at is your nursing interventions when you have a patient that is on a diuretic. Now, I'm going to talk about, firstly, some general nursing interventions that apply to every diuretic, and then we'll move on into some specifics of the diuretics we have discussed so far. So one of the first things you want to do as a nurse is to monitor vital signs. Now, we know that it is fundamental for us as nurses to monitor vital signs because this helps us, or this gives us a baseline for which we compare subsequent vital signs to. You also want to monitor your weight, and you want to monitor urine output. Now, the reason we want to do this is that diuretics primarily work by increasing your urine output. So you want to keep a close eye on your urine output so you are able to determine the effectiveness of the medication that is being administered or is being given. Also, you want to monitor your electrolytes, your kidney function. We know that most of the diuretics we give either causes you to lose some electrolytes or to retain some electrolytes, and so you want to keep a close eye on the electrolyte levels. Also, your kidney function, because these medications work directly on the kidneys, it is only wise, or it is only appropriate, that as a nurse in the bedside you're keeping an eye on your kidney function so you're able to detect any changes that may occur. One of the other things you also want to check is to check your peripheries for any sign of edema. Another first sign of edema you are likely going to see of fluid retention is usually edema in the peripheries, and so you want to keep an eye for this. Now, it is important that you instruct patients on how to monitor their blood pressure. I believe that because diuretics work mainly to reduce your blood pressure, it is good that you always keep an eye so you don't become hypotensive. And finally, you want to encourage patients to take these medications in the morning. This is because you want to prevent nocturia and to promote sleep at night. Now, we want to move into some specifics when it comes to the various class of diuretics we talked about. So the very first one we are going to look at today will be your loop diuretics. Now, we mentioned that furosemide is one of the examples of a loop diuretic. Now, the one thing that is associated with giving furosemide quickly is ototoxicity. So you can become deaf when you give IV pushes of furosemide very quickly. So usually when you administer IV furosemide, it is advised that you give it slowly, just so you can prevent any occurrences of deafness or hearing loss. Now the other thing is that loop diuretics are usually potassium wasting diuretics. And so you want to encourage your patients to eat foods that are rich in potassium, and you want to monitor your electrolytes. Now, in the acute hospital setting, you may give replacement for potassiums. Now, most potassium tablets are moderate releases, and so under no circumstance should you crash your potassium tablets. Now, I need to mention that in the hospital setting, you may see potassium tablet being crashed if the patient is not able to um, eat orally or take in things orally and has got an enteral mode of feeding. Then in such cases, you may be able to crash and give. But on the Nclex-RN exams, usually you don't crash potassium under any circumstance. Now, moving on to thiazide diuretics. Now, we did mention that it needs to be used cautiously in patients who are taking lithium and or digoxin. So one of the things you want to look out for will be signs of lithium and or digoxin toxicity. You also want to monitor your electrolytes. Now, thiazide diuretics tends to, excrete a lot of your electrolytes in the urine. So calcium, magnesium, potassium. And so you want to keep an eye on it, and these things are replaced as needed. You also want to instruct your client to eat foods that are rich in potassium. Now, one of the things that can happen when you take thiazide diuretics is what we call orthostatic hypotension. So you want to encourage your patients to change positions slowly and not to do it very quickly. Also, you want to use sunscreen when you're outside in the sun, because when you take thiazide diuretics, it increases your photosensitivity. With potassium sparring diuretics, one of the important things you want to keep an eye on is signs of hyperkalemia. Now, this type of diuretics causes you to retain potassium, and so you want to constantly check potassium levels, and it should be between 3.5 and 5 milliequivalents per liter. Now you want to instruct your client or your patient to avoid foods that are rich in potassium, and also to avoid salt supplements, because these ones also contain some potassium. Now the signs for hyperkalemia usually would be nausea, vomiting, abdominal cramping, tachycardia. When you do an ECG, you find that you've got an elevated P wave, and you can usually become oliguric as well. With osmotic diuretics, you want to monitor for signs of dehydration. Also, you want to monitor your client's neurological status. You want to monitor for signs of increased intracranial pressure. Remember, we said that when you've got increased intracranial pressure, one of the temporary fixes is mannitol, which is an osmotic diuretic. So you want to monitor for signs of either increasing or decreasing intracranial pressure, as well as intraocular pressure. It is important to note that when mannitol crystallizes, we don't administer it. And so before you administer mannitol to any patient, you want to check for crystallization in the bag or in the ampule. Thank you very much for watching. In today's video, we looked at diuretics. and we look at the types of diuretic. We said we've got 4 types of diuretic: your loop diuretic, your thiazide diuretic, your potassium sparring diuretics, and your osmotic diuretics. And then we talked about the things we need to look out for and the complications and contraindications for some of these medications. Thank you all for watching today's video. I'm glad you stayed to the end. If you haven't subscribed yet, I want you to hit the subscribe button. You want to like this video, share and comment on the video. If you've got any questions, I will come back and address them as soon as possible. Thank you for staying with us, and we'll see you in the next video. Bye-bye.